The 31st this year occurred on a day where once again there were no deaths, there was no community transmission occurring in Australia, and there were 7 international cases. And as Dr. Finkel reminds me, and as Professor Kelly, when you're identifying and securing these cases when in quarantine on return of Australians back to Australia, then that is a sign of the system, working, and we welcome that. It's been another very positive and very practical meeting of the National Cabinet. There will be a statement issued later that will go into much more detail, but would note the key items that were discussed today, and I'll ask both Professor Kelly, as is usual, to run through the key items from an epidemiological point of view, and it was briefed to National Cabinet today, but I'll also ask Dr. Finkel to speak on what was one of the key matters that was dealt with today. And that was the National Contact Tracing Review, which we received today from Dr. Finkel, and I want to thank Dr. Finkel, as well as Lee Jasper, a digital technology and delivery expert, very successful professionally in that area, commercially, and Dr. Taryn Wiramonthri, a public health expert for many years, was the WA Chief Medical Officer, and the three of them have worked together to do an exhaustive review of the contact tracing system in each state and territory, and making recommendations and observing the improvements that have been made there. And there's a set of recommendations, all of which have been adopted by the National Cabinet today to take forward. So I thank Dr. Finkel for that, and he can take you through those recommendations in more detail. Also today, the national vaccination policy of the Commonwealth was endorsed by the National Cabinet today. Not just noted, they were keen to endorse it as well. And that's another sign that together as a country we are working to prepare ourselves to be able to disseminate and administer those vaccines all around the country when they're ready, when they have passed the necessary TGA approvals to ensure that they are safe. Once we have cleared those important benchmarks, then we must be in a position to be able to disseminate and administer those all around the country. And of course that requires the usual support of states and territories and how that's done. And Professor Kelly, who is the Deputy Chair of the advising group to the Commonwealth on our national vaccination policy and strategy, will be able to update you on that policy, and that will also be released today together with this document as well. The framework for national reopening, when we met last time, we were able to adopt that in principle, but we had 2 jurisdictions that were still in caretaker mode. So the plan that I outlined at our last meeting and that we spoke of here after the last meeting has now been agreed, with the one exception of Western Australia, which I've already flagged. That is a plan to have Australia open by Christmas, with the exception of Western Australia. It also is a plan that importantly embeds public health metrics in ensuring that when Australia opens safely, that it remains open safely. And that's incredibly important. The things that need to happen, and importantly the work of Dr. Finkel's contact tracing review, which also identifies additional metrics that are needed to make sure that we are always aware that we are staying on track and have the protections in place to keep Australia open. Other matters dealt with today, of course, is getting Australians home. This remains a very, very significant challenge. And while we will see some 25,000 odd Australians return to Australia since I first spoke of this some weeks ago, if not months, the number of Australians coming onto that list, as you know, has been growing every day, every week, including the number of vulnerable Australians. We're getting vulnerable Australians home, we're getting thousands of Australians home. We've today increased 150 additional places coming out of Queensland. We thank them for that. We have additional capacity, as I announced last week when I was in Tasmania. We've got additional capacity we were signed up to in ACT and the Northern Territory. But the challenge is still greater than the capacity to receive people back into quarantine. Now, obviously, Australia is going to maintain its quarantine arrangements for people returning overseas. National Cabinet and the Commonwealth Government is very committed to that. This has been one of Australia's great successes. And as I was discussing yesterday with President-elect Biden, was one of the reasons why Australia has been so successful, as we've put these strong measures in place. And I should have mentioned that a copy of this National Contact Tracing Review as a result of the discussion I had with President-elect Biden yesterday, I'll be forwarding to their team because it tells the story of why Australia is being successful and will continue to be successful. We'll, of course, copy that to the US administration as well. But given President-elect Biden's interest in this issue and the people he's bringing together there, he was very keen to know what we were doing. And I'm sure, while not able to get on a plane and go there, Dr Finkel and his colleagues would be available to assist wherever they are, in whatever country, to learn from Australia's experience. But in terms of getting Australians home, there's greater flexibility that will be applied to the caps. The caps have been done on a daily basis, and that would mean on some occasions a cap might be fully utilised on any given day. So by doing them over a week, that means we can get greater utilisation of the caps, which will increase our ability to get more Australians home. And wherever possible, we are looking for additional capacity. I'll be meeting with the Victorian Premier when I go to Melbourne next week, and there will be the opportunity for us to talk about that. I know they're progressing on those issues, and he gave us a bit of an update on that this morning, but they're not yet in a position to make an announcement yet. But that's because they're preparing to be able to do it, and we welcome that from Victoria. And when Victoria opens up to receive those flights again, that will help us get many more Australians back. And the figures I talked to you about before of around about the mid-20,000, 25,000, that wasn't assuming a Victorian participation, so that will add, we believe, to our capability to get more Australians home. But the challenges we have in getting Australians home means that the ability to move and take international students back at this time through quarantine arrangements does not present itself. It's Australians coming home first. That is the Commonwealth policy, that is our policy, and that is the policy that is also being followed by the National Cabinet. We need to use every available space that we have in quarantine. And it's not just simply a matter of are there rooms in hotels to do it. There is also the police support that is needed to properly run quarantine and the health support that is needed in addition to that. So it is a function of all of these, and the quarantine system has been working effectively, and we want it to keep working effectively. What we're seeing around the world, which Professor Kelly will speak to, is heartbreaking. I had another meeting with the European leaders this week, which is that group I've been meeting with for many, many months. And the situation there is very serious, as it is in the United States. And that means here in Australia we need to continue to be careful. And we will be. So sadly that will delay any ability to be bringing international students to Australia soon, because we must use every available place to get Australians home. Just finally, the national natural disaster arrangements that were subject to the Royal Commission. I tabled with my colleagues today the Commonwealth's response to that Royal Commission. The Minister, Littleproud, who'll be standing up on that separately this afternoon. Our response will be released on that today. What was important in the discussion we had today, though, was there are very good practical operating arrangements between the states and territories and the Commonwealth when it comes to dealing on the ground with these natural disasters, whether it's the combating the fires or dealing with the cyclones or the floods. There are very good operating arrangements. And the Royal Commission points to how they can be improved, and particularly around some of the governance issues that sit above that. But the last thing we want to do as Premiers, Chief Ministers and Prime Minister is interrupt operational arrangements that are working well in how people are moved between jurisdictions, how equipment is shared, how the equipment that is needed is identified by fire chiefs. That is what we respond to, and we'll continue to do that. But I'll leave it to Minister Littleproud to deal with the many other aspects of that later today. And the National Federation Reform Council will meet on the 11th of December. And my suggestion, and it was warmly received, a key focus of that meeting will be on mental health. We will have the Productivity Commission report out at that time. We will also have the National Suicide Prevention Advisors report available and out at that time. There is the interim report of the Royal Commission in Victoria. And we all agree that particularly after a year where Australians have been so tested and our mental health systems and support have been boosted, at a state and territory level and at a Commonwealth level, at unprecedented levels, then it really is about how we maintain our effective supports and improve them into the future. That will be addressed along with the other items that are standing items on its agenda: women's safety, Indigenous closing the gap measures, and other measures will be added to the agenda as necessary between now and then. So with that, I'll pass you on to Professor Kelly, and then I'll pass you on to Dr. Finkel.
Thank you, PM. So as the PM has mentioned, another excellent day for Australia. No deaths and no locally acquired cases. So we do have 7 overseas acquired cases, 5 in the NT. That's related to the recent arrivals on those assisted flights from the UK and from India that are and people currently in quarantine in Howard Springs. And then 1 each in New South Wales and Queensland, again in quarantine. And as the PM mentioned, this is a sign of success for our measures there. In terms of the total numbers since the start of the epidemic in January, 27,698 with 907 deaths. The current situation in Australia, we have over the last week 77 active cases, 22 in hospital, and no one, not a single person in intensive care. So over the past week, we've had 58 cases in Australia, across Australia, of which 56 are overseas arrivals in quarantine. So only 2 cases in the entire week. I just need to really stress the contrast of that with most other countries in the world. If we take the UK, for example, just in the past week, they've had 157,000 people have been diagnosed. And they have now over 50,000 people have died from this virus. In the US, in the last week, 731,000 cases. They have 65,000 people in hospital. Their hospitals are overstretched, as is the case in many other countries around the world. It really just reinforces the importance of keeping our borders secure. The other element that the PM mentioned was the vaccine policy, so that will be released publicly today. And so Professor Murphy actually gave an update in relation to that to the premiers. So we now have our advanced purchase agreements for 4 different types of vaccine, 134 million doses, plus our signing up to the COVAX initiative, which would guarantee 50% of our population will be covered through that process. So we have many possible vaccines available. The question remains about their stage 3 trials. Are they effective? Are they safe? We had very good information on the Pfizer vaccine, which we are signed up to this week, and we expect other advice from those trials in coming days for the other vaccines. So the AstraZeneca vaccine, which will be and is currently being manufactured in Australia, as soon as that has regulatory approval, it will be available. The Novavax vaccine and the Pfizer vaccines will come from overseas, but they are guaranteed to get some supplies there. The University of Queensland vaccine, Minister Hunt's been up there today talking about that, and they've made major advances as well, but they will be later in the year when we get those available. The key question is, will they protect against transmission or severe disease or both? And that will be the fundamental driver of the prioritisation of the vaccine to various parts of the population. And that's outlined in general terms in the policy, but it will be absolutely the medical advice from the ATAGI group, our advisory group on immunisation, which advises the Minister for Health on these matters, and that will be what guides the prioritisation. The general principles there are those that are caring for vulnerable people themselves, and those at highest risk of transmission will be the ones on the priority list. At the national level, in the Australian Government Department of Health, we are forming a vaccine division, which will be driving this from the Commonwealth point of view, but the states and territories, of course, will be involved and engaged very much on the distribution and logistics of the vaccination program, as they always are, so we're not duplicating there. The final point was made very clearly by the PM, as is done previously, is that this vaccine will be free for all, and all Australians, for anyone who wants to take that vaccine. I'll pass over to the Chief Scientist now to talk about his excellent report.
Thank you, Paul, and thank you, Prime Minister. So, as the Prime Minister said, we've just submitted to National Cabinet today the National Contact Tracing and Outbreak Management Review that was commissioned 2 months ago. I can tell you it was a very thorough review. Even though time was short, we had the opportunity to visit personally the majority of the jurisdictions, the states and territories, and the others we did by video. And we were warmly welcomed, and the states shared all the details of their public health and contact tracing and outbreak management systems. And I do extend my thanks to all the people we met in all the states and territories. We consulted with experts. We had an opportunity to go back and do a second round with all the states and territories and the Commonwealth, of course, the Commonwealth Department of Health. And I'm therefore confident that our report has had the opportunity to cover all of the issues. Speaking of confidence, perhaps the overriding conclusion from our report is that there is good reason to be confident in the contact tracing and outbreak management systems in Australia. But, as was pointed out to me again and again and again, that is the second line of defence. Critically important is the preventative measures, which start from the responsibility of the individual through hygiene practices and staying home if unwell, through physical distancing and other measures at a more macroscopic level, such as limiting appropriately access to high-risk facilities such as aged care facilities. One of the things that we saw and encouraged through our report is a process of continuous improvement. The COVID-19 disease, the underlying virus, is difficult to understand, and it has caused havoc, as you know, around the world, and so we cannot afford to rest on our laurels, and the states and the territories and the Commonwealth do recognise that. But how do you know, in the absence of cases in the field, how do you know that the systems in place are capable of performing if and when there is a problem in terms of outbreaks? Well, you have to do desktop simulations, you have to do functional simulations. The states and territories and the Commonwealth understand that, and we've recommended ways that they can do that even more and more efficiently. We also recommended some simpler and I would say tighter metrics that will enable the public and the other states and territories to evaluate the performance of each state and territory, and they're listed in the review, of course. Going forward, a couple of things to keep in mind. One is that we've recommended that there be a means of digitally exchanging information between the states and territories, because you must keep in mind that under the Constitution, each state and territory is responsible for public health in their borders. And they do it and do it very, very well. But as we go to a more mobile society and a fully active economy, they need to be confident that they can share information about people who are travelling from jurisdiction to jurisdiction. Now, at the moment, the problem is not manifest. We don't have a serious issue, but we need to be preparing. So we've recommended a very light touch digital exchange mechanism that will respect all of the legislative and privacy requirements to enable states and territories to swap contact tracing information with each other and access contact tracing information from government agency databases. The second thing to keep in mind going forward is the importance of learning from each other. And one of the things that I would draw your attention to in this report is the listing of what we call the characteristics of an optimal contact tracing and outbreak management system, which is not a checklist that the states have to go through one by one and check themselves again, but it is a list that we've recommended that each state and territory evaluate themselves on from time to time. I'm confident what's there at the moment. Australia is doing well. We can't be complacent. If we do undertake the recommendations in this report, which was adopted by the National Cabinet today, I guess the way I would like to put it is we will go from good to great. Thank you.
Thank you very much, Alan. Happy to take questions. Let's stay on National Cabinet first, and I'm sure you want to go to other matters.
Thank back into the country. We had the situations, I think, where there were plans for the pilots.
Pilots will go ahead.
The pilots are still going.
Because they're being done above caps, yeah.
Okay, and when do you think that the international students will be able to come back? And given that the universities are particularly reliant on international students as a source of income, are you going to have to revisit maybe providing support to universities if there is a sort of a delay in coming back?
Well, there's been significant support provided to the universities. The $1 billion additional on research funding included, as well as the guarantee of their funding as we set out in the budget. But that said, I mean, this is a question of priorities, and our priorities must be to look after Australian citizens and residents first. Now, because of the deteriorating situation in other parts of the world, we are seeing more Australians even than a couple of months ago seeking to come back. More Australians who may be finishing off work contracts or studies or other arrangements they've had over the course of the year and now registering and looking to come back. And so they are difficult choices. Of course, we would like to see so many parts of our economy return to normal, but we must ensure that we put Australians first in that task. It is constrained by the amount of quarantine that exists at a state and territory level, and that's a fact that we have to contend with, and where we can expand that, we are. But the suggestion, if there's a suggestion, I'm not saying you are making that suggestion, that somehow the quarantine can be waived in order to get through this, well, that is not an option that either the Commonwealth or indeed the Premiers and Chief Ministers are prepared to contemplate, because the inherent risks are there. I wish it were not so, but it is so, and that means it's very difficult to say when we'll be in a position for more of those students to come in the future. Now, many of them are already here, we know that. But for those who would be seeking to come back, well, there is a queue, and Australians are in the front of the queue.
Given this, do you have any strategy to try and retain this market in the longer term? For example, to work nationally with universities to promote online courses, to give some approximate date when you think that we will be back in more full operation?
The short answer to that is yes, and that strategy has been working out this year on the very things that you've just suggested. That's already happening. And the Education Minister is continuing to work with states and territories and the university sector to get plans in place for when they can be activated. The frustration at the moment is, and we'd hope to be further ahead on this now, but the fact is there are many Australians in invulnerable situations, and they're seeking to get home, and that must take priority. And I'm sure the university sector would understand that. But yes, no, we have those strategies, and including the visa, we will do everything that we need to do in order to ensure that we can maintain the viability of those operations. But at the end of the day, our universities are there to ensure that they're providing quality university education to Australians, and where there's the opportunity to do that for international students as part of that business model, that's fine. But we're guaranteeing their funding, so Australian students continue to get additional places at universities, 30,000 additional places next year. 30,000 additional places in universities next year for Australian students to be able to go and take up that opportunity. And I think that's fantastic, and that's particularly the case in regional areas.
On the vaccination program, there will be a lot of people who will be reluctant to be vaccinated. There's a lot of anti-vaccination material circulating on the internet. I'm just wondering what measures the government might have in mind to regulate that, if any. What sort of encouragement you would give people to be vaccinated, and what sort of restrictions there might be for people who don't be vaccinated? Well,
I'll ask Professor Kelly to speak more to the vaccination strategy. But as you know, it won't be a mandatory vaccination. That is not the government's policy, and has never been the government's policy. And there is a lot of misinformation that's out there. You don't go to Dr. Google, you go to the doctor. When it comes to these things, and seek your medical advice from your GP or your other medically trained professionals who are there and available to assist you. And so that doesn't change. And of course, we would encourage people to take up the opportunity, but they will make their own choices, and we'll be seeking to provide the necessary assurances about the safety of the vaccine. That's why it has to pass the TGA standards. There are no shortcuts here. There are no lower benchmarks that apply to this vaccine. It's a very important vaccine for the country and for everybody's health, but we will be applying the legal requirements that are there for people's protection. But Professor Kelly, did you want to add to that?
Thanks, PM. So firstly, we are an excellent immunisation nation. Most people agree with immunisation being an important component of our preventive strategy for ensuring the health of the nation. So this is not the first time we've had an immunisation program. We roll out new immunisation programs often. But I would say this has particular challenges as to the newness of it and so forth. And so we're very aware that there will be people that are not wanting to have this vaccination or to spread information which is not true. So we have, as part of the strategy, a very strong component of communication. That's already starting, putting out information about the types of vaccines, their advantages and so forth. As the PM said, absolutely, there are no shortcuts to this. It's going fast, that's true, but all of the processes for regulation will be there. All of the systems to make sure that we're certain about safety, and if anything happened, that we would know about it and be able to deal with it quickly. And people will be very much encouraged, and I'm sure there'll be a lot of people that will be queuing up for this vaccine through next year.
There's a growing frustration about the standoff between New South Wales and Queensland and the fact that the relationship between those two premiers appears to have really broken down now. Do you think there's a role for yourself to kind of broker some sort of deal between them, or are you hands off and just leaving it to them? Well,
I have an agreement with both of them that will be open by Christmas. That's what the National Cabinet has brought them to. Now, the timing of that has always been up to the individual premiers within their jurisdictions. I mean, the Federation is still the Federation. That hasn't changed. The Constitution is still the Constitution. They both joined the meeting today very productively and very positively. So, sometimes these disagreements, I suppose, and what are written up as conflicts are maybe a little more dramatised than the reality actually is.
Just on you mentioned that you're going to pass on a copy of the National Contact Tracing Review to the Biden team on a day where the US has recorded 150,000 new cases in a day. Do you think that the Trump administration can also take a leaf out of that book as well? And are you hopeful that the situation in the US will improve under a new approach from Biden?
Well, look, I wouldn't comment on that other than to say that we're sharing our learnings both with the administration and the incoming administration. The reason for that is I was invited to do so by President-elect Biden yesterday in our conversation. He was very interested in Australia's success, and it's obviously the top of his priority lists as he's been saying himself, and I wish him all the best. I wish President Trump all the best in dealing with what is just an awful situation there. But the situation in Europe's the same. The situation in Europe is just terrible. I mean, the number of deaths, 50,000, didn't you say, Paul, in the United Kingdom? I mean, the death toll from the Blitz was less. I mean, that puts some perspective on what's occurring. Now, of course, the Blitz had many thousands, tens of thousands who were injured and maimed, and that was obviously a calamity during wartime of extraordinary proportions. But when you think about that, and the population at the time was much lower than it is today, but the situation that is happening overseas, we can't ignore. And the comparison to what's happening here in Australia by the great work that's been done right around the country is a tremendous credit to this country, and it's been noticed around the world. I mean, how we do things here, the question just on immunisation, Paul's absolutely right. No one does this better than us. No one does it better than us. We're really good at this stuff, and Australians can take some confidence about that, I think.
Just on state borders, obviously WA is set to reopen to most states tomorrow, but the health minister has said they'll slap restrictions back up, hardboil right back up should the risks come back. Have you encouraged them not to be so hasty, especially with potentially some of the sharing of contact tracing, digital information, that might not be necessary? What's your response to this kind of
What I was pleased, and Dr. Finkel, you might want to comment on this because you spent a lot of time looking at the Western Australian situation, and the former Chief WA Health Officer was on your panel. But what today said And what Dr. Finkel's report demonstrates in the work is that Australia's system is good, it's strong, and we can have confidence in it. That doesn't mean there aren't risks. I mean, there is no world without risks. Of course there are risks. You can't manage to zero risks. And that's not the National Cabinet's policy. It is suppression. And the systems that support a suppression strategy are contact tracing, are testing, are the COVID safe behaviours, and in particular the registration systems, whether it's the COVID safe app or indeed the other technologies which are becoming so much more commonplace and need to become ubiquitous. I mean, here in the ACT and New South Wales, the whole process for registration with quick population of your registration using the codes and so on, this is becoming quite normal for people. And I notice young people are used to it very, very quickly. When I was in Tassie the other day, doing the same thing as Jenny and I went out to a restaurant and we did it, and then we went for a quiet little drink afterwards at a pub and did it as well. This becomes normal, but these systems must become ubiquitous across the country, whether it's in Western Australia or in Tasmania, and in particular in states that are opening up. This is even more important. New South Wales is battle-hardened on this. They've been doing this for some time now, and so their confidence, I think, is rightly strong. But in other states opening up, I'd encourage them to push through like New South Wales did, because the task is to reopen safely and then to stay safely open. By staying safely open, you are giving confidence to businesses, to people in jobs, to people to make decisions about their future and what they're going to do. Stop, start does not provide that. So I have no doubt that that would be the intention of the Western Australian government, to open safely and to stay safely open, because that's what's in the national interest and that's what's in Western Australia's interest. But Professor Finkel.
So, Prime Minister, I would add that states will open their borders if they're confident in the other states and their own ability to deal with any outbreaks or cases that occur. As we travelled and we looked at the systems, we saw fabulous evidence of well-established, enduring public health systems in many of the states and territories, and progress towards that in the ones that started a little bit behind at the beginning of the year. The other thing that has been impressive to note is the way the states have converged on consistent public health advice to the citizenry in terms of their personal actions and behaviours, the things that they're responsible for, and also the COVID safety plans that are now required of every single enterprise, whether it's a government workplace or a university or an aged care facility or a sports venue. It takes time to bring these kinds of things on board and to learn from experience and know what will be effective, but they've been through that, and the preventive measures in place are effective and I think really quite well communicated to the citizenry. And the third thing is perhaps still evolving, but it's doing well, and that's the increased use of technology. Because if numbers are high, when numbers are low, everything's easy. But if numbers are high, there's a finite workforce to deal with the numbers that are there. Every state and territory has been thinking about where it will get its surge workforce by training other members of public servants from other departments, or seconding people from other agencies. But ultimately, the efficiency of every single one of those people can be significantly multiplied by having technology to support them. Technology starts from the moment that you go to have a sample, a specimen collected. That information can be and is increasingly digitised, so there's efficiency all the way through from taking the sample through the pathology lab to informing the patients who had a sample taken, a test done, through to informing the health departments of those positive test results. The allocation of those positive cases to a case interview officer can be done digitally, so that never again should a case interview fall through the cracks, etc., etc., etc. So the combination of those three things, public health expertise, good preventative health measures in place that are well communicated, and the increasing use of technology, I think should give states, whether it's the leadership or the population, confidence that Australia, certainly in comparison to the rest of the world, but also in an absolute sense, is in a good place. Not perfect, but a good place, somewhere I'm certainly happy to be.
Catherine, I will come over.
It's obviously overseas, and the devastating figures that you've drawn attention to, doesn't logic suggest that we're not going to get international students back in Australia in large numbers until we've got a vaccine? To Professor Murphy, Professor Cameron, sorry. Forgive me if I'm wrong about this, but the Pfizer vaccine, I gather, has to be stored at very... you've got to freeze it, basically, or keep it at very low temperatures, right? If that's the model vaccine that ends up being rolled out first, do we have the infrastructure in the country in order to roll that out? To Dr. Finkel, you've said in your contact tracing review, which we've only just got, so I haven't read it, but you've referred to digitisation to refer data between states. Does that require legislative change, given the constitutional arrangements? And what exactly are you talking about in terms of transferring information? Sorry.
Well, why don't you gentlemen start?
Some of the last.
All right, we'll start with the last one. So the mechanism we recommended, which we've just called the data exchange, is a very light touch but highly efficient approach. So all it does is open up a communication pathway between the digital system in one state or territory and the digital system in another, and also, where appropriate, Commonwealth government data bases just for contact tracing information. So the recommendation is that a request goes out for some contact tracing information, it gets responded to, but the data never gets stored in the data exchange. So there's no need to reconcile two disparate databases. There's no large target for cyber attack. So it intrinsically, and certainly if done properly, should be very, very secure. It's unlikely to require legislative changes, but until the final design is done, it's not clear. But we've certainly recommended that it be built consistent with the legislative requirements at the state, territory and Commonwealth levels for privacy.
Yeah, so just add to that, and the concept is to start with a pilot program between New South Wales, Victoria and ACT. They're the ones that have expressed a particular interest in this, and we'll be working with them from the Commonwealth level on the data exchange. Just on the vaccine, so the Pfizer vaccine, you're correct, it's a type of vaccine known as messenger RNA vaccine. At the moment, it's a brand new technology. At the moment, for stability, it needs to be kept at -80, which is dry ice, essentially. So that is a challenge. It's one of the many challenges in relation to this vaccine rollout, but it's only one of the four types of vaccines that we've signed up to. If it's the first, Pfizer, as part of their agreement with us, is that they have guaranteed that they will deal with the distribution issues from the place of manufacture to the place of immunisation. So that's part of the contract.
And on the other matter, no, I don't know if night follows day in that way, Catherine. I mean, the key constraint at the moment in people coming in is the capacity of quarantine. And if there are ways we can boost that, then that's great. And that's what we're working on at the moment. But the rush of those additional seeking to come back has obviously exhausted that resource, and that's why we keep adding to it. But I've got to say, the fact that we no longer have New Zealanders coming through that process, that's freed up some additional capacity. Equally, as domestic borders go down, then we won't have Australians from each other's states sitting in hotel quarantine, and that will enable more Australians to come home, and that will be helpful without accessing one additional room and having or one additional police officer or health worker to be able to support that capacity. So as Australia opens, we will get more. All we said today is right now, as we're looking towards Christmas, I can't give a commitment to the states that we'd be in a position to allow any broader entry of international students at this time. But we'll look at it again in several weeks, and I hope if we're able to establish some additional capacity and how things may change in terms of those seeking to come back, it's understandable that many are looking to get back before the end of the year, around Christmas and so on. But we'll keep a close eye on it, and we'll keep working closely with the sector.
On your three-step opening plan, you've said earlier that it's the timing of each of the steps and the measures is up to each Premier in their own jurisdiction. Business has said that it's quite confusing, the sort of piecemeal manner. Was there any discussion or commitment to, I guess, doing a kind of report card, something that's combined that shows what all the states are doing when? And just on the international arrivals, can you give us an update on the net figures? How many people are on the list now? How many have actually come back of that 26,500 from a couple months ago?
Well, to be honest, it changes very regularly, and I'd be happy to distribute those accurate numbers through my office about the number as we have it right now, and I suspect it'll be different again tomorrow. I would note, though, that over the course of this pandemic, more than 400,000 Australians have come back from overseas. 400,000, that's a lot. And I'd add that we have already, since the 13th of March, helped over 30,800 Australian citizens and permanent residents return home directly, and that includes over 10,000 on 358 flights, of which 67 were directly facilitated by the government. And we have many additional flights now that we're doing now. So this has been an ongoing process for many, many, many months, and we've been getting through it as best as we can. I can tell you, the figure I have here is that there's some 35,600 still registered abroad who've indicated an interest in returning to Australia, and that's it's around about 10,000 more. And then when we're talking about, and that includes people already having got back out of that caseload. And so it is a cup that keeps filling up every time we get someone home. And so that will continue to be a challenge. I think I missed the second part of your question.
The first part was around the reopening plan. Is there any...
Yes. Yeah. Well, look, we do have assessment across all the states and territories, and I can understand the need for that. I mean, it's a big exercise to get 7 states and territories to agree to get this done by Christmas, all of it. And the states are always very adamant, extremely adamant, about the decisions that they take, of what happens within their jurisdictions, and that's the Constitution, and that's how the system works. And so the Commonwealth obviously has no ability to change that timetable through, I suppose, a force of national interest. We've been able to get to the agreement that we have, and I welcome that. But we're moving quickly. As I said, the many jurisdictions now have announced, and more will, I know, when they're opening up to Victoria. We've got Victoria opening up as well, and people moving around and accepting international flights, which is not too far away. There is a frustrating patience that is necessary as we move through this, but when you compare that to the uncertainty of those in other places, this is the best place to be in the world.
What progress has been made?
Don't worry, I won't leave you out. I'll come here.
A number of your state and territory counterparts want to see the practical action on the Natural Disaster Royal Commission extend to carbon emissions policy, a commitment to net zero by 2050. What's your reaction to them? What's your message to them? And very separately, you are planning to travel to Papua New Guinea. We're seeing media reports that there is a political challenge on the Prime Minister. If he is ousted, will you still go there?
Well, I'm not going to speculate on those events, but it's my intention to be with Prime Minister Rappe next Wednesday as planned. And I'll be heading up to Japan, obviously, before that for the important meeting with Prime Minister Suga. And we have the ASEAN meetings virtually over the course of this weekend. And Dr. Finkel may want to comment on this as well. One of the key findings, conclusions of the Royal Commission was that the locked-in impacts of climate change already that are there largely set an elevated risk for the next 20 years. And the report actually says that regardless of what might happen in terms of emissions reduction, that is a known quantity. And as a result, a key part of dealing with climate change in this country is dealing with the resilience to what is already there. And that is a big part of what the Royal Commission recommends. And I've been advocating, some of you may recall, from my first speech at the National Press Club at the start of this year, I said this agenda has to be about resilience as well. Of course it's about emissions reduction. Of course it is. No argument about that from the government. But it also must be to protect Australians and keep them safe. It is about resilience measures, and that's what our response will certainly address, and in subsequent announcements that we will make. That is what, in some respects, the National Bushfire Recovery Fund, in part, is addressing. Our commitment is we would like to achieve the outcome you've indicated as soon as we can. But we will get there with a technology roadmap which achieves that result, not through taxation. See, if you can't get there by technology, you get there by taxes. And we are not going to get there by taxes. If other countries choose to get there by taxes, that's a matter for them. But Australia will set our response and will meet our commitments based on our national interests and the policies we set here in Australia. And that's why our technology roadmap is so important. Because if we're talking about reducing global emissions, not just Australia's emissions or indeed other developing countries' emissions, then we must have technology in developing countries implemented, affordable, scalable, commercial, that will transform their economies as they grow. Because all the increase in emissions is going to occur in developing countries. That is what is going to continue to see emissions rise into the future. Developed countries, we're reducing our emissions. We're signatories to Paris. And we will meet those commitments as we have been to Kyoto. And we've had great success there. And we believe we'll have great success in the future. And so I've been really clear with Australians. And that unless I can tell you what it's going to cost you, unless I can set out that plan for how it's going to be achieved, then I think we are leaving Australia in a position that is vulnerable to a situation that would see higher costs imposed on Australian families, when I believe that the path to it is in better technology. And that has been a view that we've developed, closely informed by the work of the Chief Scientist. So I'll invite him to make comment.
So earlier this year at the National Press Club, Prime Minister, you did talk about the impact of climate and the need to have resilient responses as well as the long-term mitigation, and you asked the CSIRO to do a report specifically on climate and disaster resilience, working with an expert advisory panel chaired by myself. And we did that and submitted it mid-year, and it became one of the significant inputs to the Royal Commission, which has been presented to the National Cabinet today. And there are many, many things that we can do to improve our resilience, but the first is to acknowledge that there's a serious problem there that has to be dealt with. The first 4 words, the first sentence in the terms of reference from the Prime Minister to the expert advisory panel and the CSIRO was Australia's climate is changing. You have to acknowledge that and then work hard to deal with adapting to the problems that are there. But at the same time, we absolutely have to be doing our piece to mitigate, to avoid emissions, to reduce emissions into the future. And there are many things that are actually underway. If you go back a longer time, there's the renewable energy target, which drove a pretty good amount of solar and wind at large scale into the market. There's the integrated system plan that AEMO is operating with at the moment, which actually came out of the review that I chaired back in 2017. And that imposes sensible connection requirements on large-scale solar and wind so that they don't destabilise the grid, and through the integrated system plan allowing long-distance interconnectors to bring electrons from where they're generated to where you need them, we can now bring in solar and wind electricity at a much faster rate than we could have contemplated. The government adopted the National Hydrogen Strategy last year, and that is actually recognised around the world as a thoughtful and significant approach to realising the potential of hydrogen to contribute to emissions reduction. And the low emissions technology statement that the Prime Minister just mentioned, which was released in September this year, is actually outlining how one can use technology to overcome the problems that are fundamentally wrought by the technology that we've been using increasingly for the last 200 years. And those technologies, the purpose of the low emissions technology strategy is to see how government intervention and encouragement and signalling can lead to the most rapid decrease in price of those low and zero emissions technologies so that ultimately they will replace the higher emissions incumbent. They cover hydrogen again, but also batteries and pumped hydro to help to firm up more and more solar and wind. They look at zero emissions steel as a future export potential for Australia. They look at low emissions aluminium as a major export potential for Australia. And then the low emissions technology statement recognises that it doesn't matter what you do, there will be sources of emissions that you can't zero out, and you have to offset that by some kind of geosequestration or biosequestration, and that's also covered in the low emissions technology statement. So I think that there are several things in place at the moment that are moving us in the right direction.
Scientifically, would you like to see, Dr. Finkel, therefore, net zero by 2050 from a scientific perspective?
I would like to see us proceed towards net zero as fast as we can do so with economic efficiency, and I think that the measures that I just mentioned to you are the kinds of things that you would be putting in place if you were trying to move as quickly as possible towards net zero.
So what progress has been made in standing up alternatives to hotel quarantine, like on campus or at home quarantine, and how far off are those alternatives?
Well, Paul might want to comment on that as well. These matters have been looked by the AHPPC. They were discussed again today, and they are not considered options that we can safely take on. Paul?
So there are some pilots in relation to on-farm quarantine, for example, for the seasonal workers that have come from very low-risk countries in Queensland, for example. That's one that's ongoing at the moment. So there are some bespoke arrangements currently operating in the States. They've made those decisions to try those pilots. But in terms, I think your question really goes to, is there large-scale alternatives to hotel quarantine? And the answer is no. And I think the reason has been outlined already about how dangerous the rest of the world is and how important our border arrangements are.
We've taken a good look at it, and those options aren't presenting. And we'll keep looking, but I'm not going to raise an expectation that you could expect to see them.
You're ruling them out. They're not safe enough. You're ruling them out. They're not safe enough.
Calm down. That's not what we're doing. We're going to keep looking at what the options are, as we always have. And if we can find viable options, then we'll implement them. But we haven't been able to find any viable options that are safe at this time.
Ian, were there any preliminary discussions today about next year opening up international travel from low-virus countries such as Singapore, Japan, parts of China, Taiwan, that you sort of flagged earlier in the week?
Well, we have a Greenland process with New Zealand. We have a process where we're investigating other countries that could potentially be considered low risk, and Paul might want to comment on that. But the decision then for that to translate into some new access, we have not made that decision at this point. And I couldn't say we'd be in that position before the end of the year. We would obviously like to be, if that were possible, but we're not going to compromise on the safety side. So what is important at the moment is that we're doing the proper assessments, and we're working with those countries. It's one of the things I'm looking forward to speaking to Prime Minister Suga about when we're up there. It's something I'll indeed no doubt talk to Prime Minister Marape about next week as well. But we want to be able to work out, well, what are the assessments, what do they look like, what sort of assurances would you need, and they're the sort of things you want to work out country to country. And you also need to do that up front with the states and territories, because ultimately they are responsible for public health within their jurisdictions, and of course we would consult them. It's a Commonwealth decision which is respected by the states and territories, but we'd prefer to do that on the way in getting their views about that and how that can work. It's working well with New Zealand at the moment. There may be small countries where there are zero cases and very low risk where that at the margin can be achieved. But I think, again, the point you made, Paul, in terms of scaled change, that is not in our immediate future. That's a reality of a COVID world that at the moment, as we see overseas, is incredibly dangerous. Paul, did you want to add anything to that?
PM, we were last time requested, the National Cabinet requested the Australian Health Protection Principal Committee, the AHPPC, to do further work on this, and we have done, looking at at a general way of looking at risk of different countries, and then a very detailed country risk assessment for specific countries of interest. So the ones that have been mentioned are the ones that are of interest. So it's those ones we have close ties with, a couple of which the PM is visiting next week, but also the Pacific, where they've had a very different experience of the pandemic to other countries around the world. So it remains on our sights, and so we're not ruling anything out into the far future. But at the moment, the decision is the world is red, which means 14 days hotel quarantine, unless they are very specifically detailed as green, in which case these alternatives might be available.
Thank you, Professor Kelly. I'm going to have to leave it there, just on that issue.
On contact tracing report?
Sure.
Did it actually identify deficiencies specifically in the Victorian system of contact tracing, and do you believe they've been fixed since?
So the contact tracing review is not the result of an inquiry, it's not a scorecard, it's truly looking at the characteristics shared across the states. I can tell you that the Victorian system is really working quite well now. It's obviously was under incredible stress and not working well 3-4 months ago, but it's actually dramatically improved.
Thanks, everyone. Thank you.